I do appreciate everyone taking some time to listen to this, whether it be now or in the future, because I know you guys' time is valuable. Indeed, we respect your time a lot, which is why we try to stay on schedule a lot. Consequently, sometimes we don't stay on schedule and we need to apologize for not staying on schedule, but we do try to stay on schedule and we appreciate your time. So thank you very much for listening now or in the future. Secondly, as we were mentioning before, I would like to offer this an invitation to all of our patients or business people around the community to come on to the show and talk to me. You guys can teach me lots of things. I'm always interested in learning new stuff. So if you want to teach me about your business or what you have to offer, we're happy to have you. If you want to come on as a patient and share your story and kind of inspire some other patients to come see us or seek help for their pain, we'd be happy to hear that too. So please use this as an opportunity to use this medium to help share your stories. Next, I wanted to say from the bottom of my heart, I really am sorry that I haven't been able to give each of you guys the time that you want or deserve. Unfortunately, medicine is a business. It's no longer just an art where you can spend as much time as you want with patients. And so frequently we have patients scheduled and I respect their time just as much as everyone else's time. So I have to try and stay on schedule. And unfortunately, that means that many times I don't get to answer all the questions or I'm trying to be efficient about my answers. And I know that's not fair to you guys. So I'm sorry that you guys aren't getting as much as you want, which is why we're doing this webinar and podcast, because it's an opportunity for you to ask me any questions you want, and I'm happy to address them, and we won't stop talking about them until you're satisfied. So I'm sorry, but we're going to try to do better and have a better connection here. Next, I'll say finally that I have many mistakes that I'm trying to correct all the time. So if you happen to hear something or find something that I say as incorrect or believe it's not true, please just let me know. There's no need to yell at me or scream at me. Just say, hey, Mark, are you sure about that? Let's check on it. And we absolutely can verify it. I'm human. I'm trying my best. So if you hear a mistake or hear me say something wrong, just let me know and we will try to do our best to correct that. These are my opinions. There's many different ways to treat patients and practice pain management. My way is not the right way. There's many different ways. But these are the ways I was trained to do it and the ways I believe on practicing pain management. So if you have a different algorithm or a different theory of how you want to treat your pain, that's where the discussion comes in with your doctor, where you should talk to me or whoever your doctor is and say, well, I really kind of prefer this option and can we meet somewhere in the middle? Absolutely, that is your right, because as a patient, you control the treatment. So you should never let a doctor do something to you that you don't understand and you don't agree with. Okay, so thank you for joining us. We're going to go to our next slide. A little bit about me. Who am I? Well, I'm Dr. Mark Moran, and I grew up in San Antonio. I've been here almost my whole life. My dad was in the Air Force for 25 years here at Lackland. So I grew up here and I went a little stint in Houston for some graduate school. And then I did a little stint in Pennsylvania for some residency and fellowship. But I've been in Texas almost my whole life. I went to Southwestern University in Georgetown, Texas, and got a bachelor's degree in biochemistry or biology. After that, I went to get a master's degree in biochemistry at the University of Houston. After that, I went to medical school here at UT Health Science Center. I spent 4 years here. I spent 4 years here doing medical school, and then I did my residency up at Penn State, Hershey, Pennsylvania, where I got my anesthesiology degree. And then I did an additional year of training, specifically training for pain management, and that's how I became a pain management doctor. Fortunately, I was very successful with my practice because of all the patients that appreciate our work and the hard work of my staff and support system. So we've grown, and I learned a couple years ago that I need to better understand the business of medicine. So just last year, I finished my education and got an MBA in business from West Texas A&M. And now you're all caught up with all my education. I tell my friends I have 30 years. I'm in the 30th grade. Okay. I've been practicing pain management since 2006, and I'm very, very passionate about offering my service to help you guys. I know that I have a lot of information and stuff that I can help you with, so I want you guys to use me for education. You can ask me questions, you can ask me why we do things, you can ask me what the purpose is, and I'm here to share my expertise with you. I want you to become an active participant in your health and not a passive recipient, and that's going to be a key theme we have in our talk tonight. What we're going to cover is try to break it down into sections, but we're going to try to cover a lot of information in this area. We're going to talk about the secret to controlling your pain for the rest of your life. I want you all to be actively participating in your health, and I also want you to know the options for treating your low back pain, so you know that you always have options. Nothing is ever just given to you. You have a choice. I want you to learn what you can do when you're not getting the benefits that you want, because it's very frustrating sometimes to be dealing with pain and you don't get the benefits you want, and you talk to your doctor and it's a very slow process. So you need to understand what your options are when you're not getting the benefit you want. Also, we're going to talk about things you can do to speed up the treatment, because it really is bad when you have this horrible pain and it takes a long time to get treatment. So I understand patients come in and they say, well, I tried to get into you last week or last month and I couldn't get in. I understand it's frustrating and very hard to deal with this pain, severe pain, and we're trying to help you facilitate that process. At the end, we'll talk about the fundamental cornerstone of lifelong health and happiness, because that's what I want everyone to be, and we'll have some questions and answers as well. I'm here for you guys. So we'll start by saying, what is the secret to controlling your back pain? And in my opinion, I think knowledge is power. And you think about a situation where you don't know what's going on, you have more anxiety or fear because you don't know what's going on. So if all of a sudden an alien pops up behind me, people would probably be scared because no one knows what this alien is capable of. However, if I told you, oh, that's my friend Bob, and he doesn't eat humans, he doesn't hurt anyone, all he does is give great big hugs, then your fear and anxiety would go down because you understand that there's no risk to you. So in dealing with chronic pain, the more you know about your situation, the less anxiety you're going to have, and the more your knowledge will power you over your anxiety, so you don't have as much fear about what's going on. Many times when you just don't know things about something, it creates fear and anxiety, which makes the situation worse. So what I'm trying to do is educate you guys so you can power yourself with the knowledge of what's going on with your back pain, and then control it for the rest of your life. And chronic pain is a really big problem. It's the leading cause of activity limitation and work absences among all ages, not just elderly people, but all ages. There's like 619 million people around the world that suffer from low back pain or pain, and it's the leading cause of disability. About 1 in every 4 or 5 Americans will have chronic pain, which is over 3 months. It's a very debilitating problem. The next thing you should know is that nearly 1/4 of people living with years of disability, so not weeks or months, but years of disability due to low back pain, were caused by occupational ergonomic factors. So that means the way you sit or stand or bend at work is not necessarily people that are lifting heavy loads or putting a bunch of stress on their back by carrying things, or the way they do their work. It's really just basic sitting and standing and bending at work that causes years of disability, which is what we're trying to prevent. It's very important to understand that healthcare costs are 60% higher in people that have low back pain than without low back pain. And talking about wealth and expenses is going to be a common theme with this talk, as we try to get you to become more actively involved with your health. More than half of workers who have low back pain spend the majority of their working sitting down. So once again, we go back to where it says nearly 1/4 of years living with disability is caused by people sitting or standing too much. Amazingly, in the US, any workforce is going to have about 15% of their workforce that suffers from low back pain, and consequently misses 10 work days a year just from low back pain. So if you have a company that has 20,000 people, or we'll make it easy, say 1,000 people, that means about 150 people every year are going to miss 10 work days just from low back pain. So that's 1,500 days a year from low back pain these people are going to be missing. It's a very debilitating problem for employees and employers to deal with low back pain. Finally, low back pain forces more people out of the workplace than any other chronic health condition, which is why we're here to try and prevent that from happening. Those of you that have had pain, you know that it's very expensive because you don't go to work and you have to pay for medicines, and that costs you money. On average, people spend 4.5 hours per day on their phone. I specifically know people that spend a lot more than that on their phone. You can see that Most people between 49 and 50 will take at least one medicine, and the average person spends $1,400 per year on prescription medicines. We all know prescription medicines are very, very expensive. As I said, there's over 100 million Americans with persistent pain, and you start to think about when you hurt yourself and you go to do these treatments, how expensive it is. Physical therapy is going to cost between $75 and $125 each session. If you have to get an MRI for your pain, that's going to be $400, $1,200 each MRI. The average pain management visit can cost you between $100 and $150 depending on your insurance plan. The cost if you miss work is about $340 per day, and usually people end up missing between 2 days and 2 weeks. You can see how the cost of treating pain really, really gets expensive, which is why we're taking the theory of prevention is much more important. It used to be medicine was retroactive. Patients would come to doctors, they would take tests, draw blood, and figure out what was going on, and they would retroactively treat a patient's pain. Now what we're doing in medicine is we're becoming proactive, and we're trying to prevent things from happening. That's this whole health and wellness movement that's around medicine nowadays. We know that it's much cheaper and much more effective to prevent problems instead of deal with them once they come on. So when I see patients, I go an exam, we talk about their history, we do all their questions and make sure we understand the situation. And then everyone, we boil down to basically 4 options for treating any type of pain. There's basically conservative therapies like acupuncture, chiropractor, physical therapy, heat, ice, that type of conservative things. The next option after conservative things is going to be medicines. And originally we try to do over-the-counter medicines. And if those don't work, then we'll try prescription medicines, non-narcotics, and then ultimately we'll try narcotics as needed for pain management. The third step is interventions, and that's where I come in because we do a lot of interventions where we do injections into the neck or low back or knees or hips or shoulders to try and help with pain so that you can get back to your life. And usually the fourth option is surgery. If the therapy and medicines and interventions don't work, you certainly can consider surgery. But there is actually a fifth option because, like I said before, you don't have to do anything that you don't want to do. And if you don't want to try anything, by all means, you don't have to. You could decide to not do anything and just deal with your pain. And we have had patients that say, it's not that bad. I don't want to treat anything. I don't want to have surgery. I'm just going to learn to live with my pain. And that is an option. Just so you know, you don't have to do anything you don't want to do. Next, moving forward, what to do when you're not getting the desired results you want. Everyone wants 100% pain relief. I do too, but sometimes that's not possible. It's very common for people to have pain coming from different areas, and the insurance companies only let us do one area at a time. So consequently, they'll come in and they'll say, Dr. Moran, you did your injection. I didn't get any benefit. And I said, well, let's evaluate you. And then we do an exam and we find out that where we did the injection, they're not tender from there anymore. They're tender from another site that causes the same symptoms. There's actually many situations where you have different causes of pain, but they cause the same symptom, and it would be impossible for a patient to understand that unless they get examined. And the example I'll give is, say you have a car that's not starting. You take your car to the shop, the mechanic looks at it, he says, oh yeah, you're out of gas and you have a dead battery and your alternator's bad. But fortunately, I put gas in your car. Well, that's great. Your car is technically better because you've addressed one thing that causes the car not to start, but it's still not going to start because you have other things that are still going on that haven't been addressed. You have a dead battery, you have a bad alternator. It's the same thing many, many times that comes with pain management. You have multiple things that cause the same symptom. We do one thing, you get benefit, but you can't perceive it because there's other things causing the same symptoms. So what to do when you're not getting your desired results? The first thing is go talk to your doctor or your provider because you want to make sure that everything is being documented, that you don't get the benefit you're wanting or you're not realizing the benefit is there. You have to go talk to your doctor and tell them how you feel. You should also be ready to prepare your mind and body for a long journey that is often encompassed with chronic pain. Unfortunately, chronic pain is defined as any pain that's present for over 3 months. If you have pain less than 3 months, it's not chronic pain, it's acute pain. But over 3 months, then you have chronic pain, and that's a long time to deal with pain. Everyone's been hurt. You twist your ankle, you hurt your knee, you hurt your back, and you have days of uncomfortableness. Imagine it being 3 months. It gets to be very debilitating. So prepare yourself, your mind and your body if you're not getting the results you need. You should look for small successes and trends in your treatment and not specific points. Everyone is going to have fluctuations up and down about their treatments. Some days they'll be really good and they'll come in and they'll say, Dr. Moran, you're the best. Other days they'll come in and they'll have a bad day and they say, Dr. Moran, you're not doing anything for me. I understand that's normal, but I want to look at the trend to make sure that over the past week or 2 weeks or month or quarter or even year, you're trending better, even though you might have hiccups along the way. You should know that there's going to be hurdles with your challenge of chronic pain as well as rewards, and share your experiences because a lot of times you get therapeutic benefit just from talking to people. Don't hesitate to talk to your doctors at any time, and don't hesitate to talk to your family or friends about what's going on, or there's even therapy sessions or consulting groups you can talk to that will help you talk to people that are going through your same situation. So prepare to succeed because everyone wants to get better and everyone's great when things get better. Your back gets better, your leg gets better, your shoulder gets better. That's perfect. That is what we all want. But also prepare to fail because the vast majority of people are going to have setbacks in their treatment. And like I have on this slide right here is that many, many, many famous people failed before they found success. Einstein's a pretty smart guy and he was labeled as mentally slow. Edison failed 1,000 times before he found a successful prototype for the light bulb. Amazingly, Martin Luther King got a C in public speaking, and he's one of the best speakers we've ever known. Oprah, who's very, very famous, got fired as a TV anchor. John Grisham wrote several books that took 28 times before it was accepted. We all know Henry Ford. He failed his first 2 automobile companies. Dyson, I think is amazing, tried over 5,100 times before he found a working prototype for his vacuum. Disney was fired for lack of imagination, and even many other people like Michael Jordan, Spielberg, J.K. Rowling, Steve Jobs, Beyonce, many, many very famous people have failed before they succeeded. So prepare to succeed. Everyone wants to succeed in whatever you're doing in life, but also you should prepare to fail because many times people are going to fail before they find success. Even this guy named Moran failed 3 times before he got accepted to medical school. So I know what it's like to fail before you find success. This is a slide I like to use when I'm talking about the basic needs of life. So this slide was created by a psychologist named Maslow in the 1940s and 1950s. And basically what he did was he says, this is what you need to live. And you can see the fundamental things you need to live are physiologic, like breathing, food, water, shelter, clothing, and sleep. You absolutely need those things to live. As you build up this triangle about fundamental things you need to live, the next one is safety and security. And importantly, the first thing under safety is health. You have got to have health as a need to experience lifelong health and happiness and success. Just like on this triangle, you can't build up on the triangle until you solidify the level below you. No one is going to work on employment or properly your family if you don't have breathing, food, water, shelter, clothing, and sleep. You have to have those basic physiologic needs. And right above that, you have to have health before you can find love and belonging, self-esteem, and self-actualization. So health is one of those fundamental things that people need to grow in life, but oftentimes they take it for granted. What I'm trying to get to the point is saying that inevitably, people will start to realize that your health is your wealth. How healthy you are easily will determine your wealth because there's many studies that validate healthier people make more money. Healthier people have more money because they don't have to spend as much money on medical treatments. We just went over the data that showed how expensive it is to get medical treatments or medicines or physical therapy or MRIs. Imagine instead of spending that money on those things, you could save it or invest it. That's why healthy people are wealthy people. And if you start to understand that your health is your wealth, you will start to realize why it's so vitally important to invest in your health. What can you do about your health? This is the whole purpose of the talk we're having to start off is I'm a firm believer in you have to be an active participant in your health. You can't be a passive recipient. When patients come in and they talk to me and they say, Doc, what are you going to do for me? That's already a red flag for me. because they're asking me to do everything for them. They're not going to be an active participant. On the other hand, when patients come in, they say, I've done physical therapy, I'm still working out, I'm doing stretching, I researched everything we can do, I know about the medicines, here's my MRI, I understand my symptoms, and this is what I want to do. What can you do? That person's going to have a very good prognosis. They're actively participating in their life. They're driving their ship and not drifting through the river. And this is a secret for anything you do in life, whether it be trying to get a promotion or trying to find a new career or trying to be a good parent or trying to do better at your job or trying to be a better athlete or trying to do anything. The more you actively participate in your goals, the easier they'll become and the more success you will find. In general, with anything you do in life, be an active participant and you will find success. The example I give here, when you come up with goals that you want to have, are first and 75. And I've told the story many, many times. Most people like football. So the beginning of the game, the football's kicked off, it goes in the end zone, they start on the 25-yard line. Have you ever seen a team make a plan to go for first and 75? The ultimate goal is the touchdown on the other end of the field, 75 yards away. But have you ever seen a coach or a quarterback call for a play first and 75? Sometimes they'll get lucky and they'll go 75 yards and make a touchdown. But the vast majority of the time, what they do, these professional athletes, they break a big goal up into smaller increments that are much more easily accomplished. First and 10. They say, guys, we're going to focus on getting 10 yards. And then what happens when we get 10 yards is, well, you get 4 more tries. And you go first and 10 again. And you continue to make this big goal into smaller increments so you can see some successes. When you come up with a chore that you want to do or a goal that you want to obtain, you don't plan on losing 50 pounds in one night. You allocate it in small goals over weeks or months. When you want to find a job and go through school, you don't take just one test at the end of the year. You take many smaller tests to make sure you're learning things and you make the big goal into smaller individual components. And it's true for anything in life. You take a big goal and divide it up into smaller, easily accomplished steps, and that makes it much more easy for you to succeed and realize your accomplishments. So don't go for first and 75 in life. Go for first and 10 and realize your benefits. It's well known and documented by good research that health is tied to wealth, which is also tied to personal happiness. Your financial security and health are strongly related to personal happiness and to one another. And there's an ancient philosopher who basically said, the greatest wealth is your health. And you think about it, all these people that are very rich, they spend a lot of money on being healthy because they know the longer they live, the more money they're going to make. So they have dietitians, they have nutritionists, they have workout personal trainers, they work on their health all the time because they know their health is their wealth. It's proven in research that your health equals your wealth, which is very much tied to personal happiness. An unhealthy life is an unattractive situation because no matter how much money a person has, it makes no sense to destroy your health in the process of saving money. If I gave you an opportunity to invest in Apple right now, before it went big, everyone knows what it's going to turn out to be. Everyone would take that investment because you know it's going to be successful. Okay, I'm telling you that right now. If you invest in your health right now, you will find success and you will make more money because you'll be spending less money on medical treatments. So consider this lesson a free lesson about you should have gotten into Apple early. You should have gotten into Google early. You should have gotten any successful business early. This is your opportunity to say, take advantage and invest in yourself right now, and you will see the benefits. This article came out of MarketWatch a couple years ago, 7 years ago. It says poor health affects individuals in many, many ways, but most importantly, it decreases productivity. And everyone knows that when you're hurt or not in good health, you're not as effective at doing things. It also makes individuals much less useful at work because now you're not as efficient, you're not as fast, you're not as energetic, you're dealing with pain, so you can't be as effective at work. Everyone knows what absenteeism is. Absenteeism is when you don't go to work and it causes productivity losses at work. Presenteeism is when you do go to work, but you're still not acting optimally because you're suffering from pain or poor health. And that actually affects work productivity as well. Poor health also lowers survival probability. So then you will be dying earlier, so less time to accumulate your wealth. And it increases medical spending because you're spending more time on poor health. So poor health affects individuals in many ways, but most importantly, it decreases productivity, it makes individuals less useful at work, it lowers survivability probability, and it increases medical expenses. And medical expenses are one of the easiest ways to lose your retirement or fall into poverty because expenses get really expensive as you're in retirement. This study out of Rutgers shows that your health affects your wealth as well, because a typical non-smoker's net worth has been found to be about 50% higher than someone who smokes lightly and twice as high as someone who smokes heavily. Typical non-smoker's wealth is more than a smoker's. In many states, there's about 20 states where there's no laws protecting smokers. You actually can be fired for refusing to quit smoking. And that's because the employers know it's going to cost them money. Remember, I told you it's 60% more expensive in healthcare expenses with people with low back pain. The employers know that if you're smoking, they're going to have higher insurance premiums because of your inability to be healthy. Studies have also found that physical appearance affects a person's earnings. So if you are looking unhealthy, whether it be overweight or non-energetic or not actively involved with your job, it will affect your earning ability. Research shows association between weight loss and health accumulation is very clearly correlated. The more weight loss you have, the more wealth you accumulate, because if people can dedicate so much time into losing weight, then they're also going to have that dedication to earning more money. And inactivity has been shown to cost between $670 and almost $1,100 per person per year just from being inactive. Once again, it makes no sense to sacrifice your health by saving money. You have to get out there and be active and be an active participant. Importantly, when you're dealing with pain or any type of medical problem, you have to know what insurance to do because they frequently limit what doctors are able to do. And the example I'll give is, say I give you a book about how to play basketball. You can read the book, you know how to play basketball, but you don't actually know how to do the skills because you haven't implemented those skills. So when I learned medicine and I learned how to treat patients, I learned how to play, but then the insurance companies come in and say, you no longer can do this, you have to follow our rules. And that's one insurance company. And there's hundreds of different insurance policies that we have to follow. And that's why it's very confusing at times to know what we're allowed to do and what we're not allowed to do, because there's different policies and the insurance companies frequently change what we're allowed to do. So patients come in, they say, last year I did this injection, I felt great, I want to do the same thing. And I say, well, unfortunately, your insurance has changed and they no longer cover that policy or that procedure. And it's very frustrating for physicians because we know what we can do to help. We know it helped last year. We know that you're going to get good benefit, but the insurance companies simply don't allow it anymore. So my advice to you is be an active participant and learn what your insurance policy covers. It clearly delineates what you need to do to treat chronic pain. I can tell you that the vast majority of insurance companies are going to make you try physical therapy recently first. You can't have tried it 2 years ago. That doesn't count. Usually it's in the last 6 to 12 months for this current injury. They want you to do physical therapy first. If that doesn't work, then they're going to let you get an imaging like an MRI or CT scan or x-rays to show that there actually is a problem going on. They're not going to trust doctors anymore to say and do an exam, oh yeah, there's a problem. They want objective data that's found with an MRI or a CT scan or an x-ray that says, yeah, there's actually a problem that we need to address. After imaging, they're going to let you try medicines, whether it be over-the-counter or prescription non-narcotics, and then narcotics to treat your pain. And then if all those don't work, then you can come in and get interventions or talk to a surgeon. The secret here is facilitate your care by knowing what your insurance is going to make you do. If you know what your insurance rules are, like we talked about, then you know what you need to do to help facilitate treatments. Someone who comes in and says, I haven't done therapy, I haven't tried medicines, I haven't taken any x-rays, they're already behind the eight ball because their insurance is going to make them do those things before we can do step 2 or 3 or 4. You have to do step 1. On the other hand, people that learn what their insurance policies require and they say, oh yeah, I know I have to do this first. I did physical therapy. Then I tried medicines. Here's the medicines I tried. They didn't work. Here's my MRI. I had to get that. Here's what it shows. Now I'm ready to try injections. They know the playing rules and they're being smart. So consequently, they're facilitating getting treatment faster, which is what we talked about. If you want to help yourself get treatments faster, understand the rules of the game, and the rules are dictated by insurance companies. And you can look that up online. If you put all these things together, we got a big picture that we got to paint. And I love this slide because everything comes down to you, one person. We have a situation where everyone is overworked and underpaid with increasing demands at your job. It's not a question of if you're going to have low back pain, but a question of when. Almost everyone is going to have low back pain at some point in their life. We know that healthcare costs are rising faster than we can keep up. Medicine is getting more and more expensive, and we know that there's a big deficit that the government is dealing with, and consequently, they're decreasing payments to doctors, and consequently, doctors can do less things, and there's less people going into medicine, so doctors are not being able to be generated as fast as the population is going. If you have the population growing faster than we can generate doctors, that just means more and more patients for doctors, which means less and less time per patient. There's insufficient medical providers, not just doctors, but nurse practitioners and physician assistants and nurses. There's just not enough medical providers, and we can't generate enough right now. And research proves that your health is your wealth, which is also your personal happiness. We also talked about insurance limitations. And if you put all these things together, it comes to one fundamental, undeniable conclusion. And that is, you have to take control of your health. Some help might be coming, but it's probably not going to be as much as you want. You have to become an active participant in your health, not a passive recipient, if you want to maximize your benefit and your health and your happiness. So if I were to take you guys and blindfold you and put you in the middle of the forest and take your blindfold off, and I say, find your way home, what's the first thing you're going to do? Imagine you don't have a cell phone. You can't call anyone. You're going to try and find out where you are because you don't know where to go if you don't know where you are. And I'm telling you guys right now, this is where you are. Everyone is going to be dealing with low back pain, and education is power. Knowledge is power. Everyone knows that your health is your wealth and your personal happiness. So you need to optimize your health, to optimize your wealth, to optimize your personal happiness. This is where you are. I just showed you the data. Now the decision becomes, now that you know where you are, you need to figure out where you want to go and take steps to get to that direction. I hope you do. You can't afford to simply drift through life anymore. Those days are gone. You have to be an active participant and drive your ship instead of drifting through life. Recently, I was reviewing some stuff online about how to be a better doctor and encourage lifestyle modifications. And I found this group called the American College of Lifestyle Medicine. It's a bunch of doctors and PhDs and intellectuals and a bunch of smart people who I trust and know that they're going to try and help me out as much as possible. And what they came up with, they took all this data and they condensed everything into 6 pillars of lifestyle, health, and happiness. So all the information they took about minimizing chronic problems, and chronic pain is one of those, comes down to 6 simple pillars that you need to maximize. One is nutrition. You know you have to eat healthy. If you eat junk food a lot, you're not going to be very healthy. 2 is physical activity, and that's what we've been talking about. You have to be an active participant in your health. This group validated that. 3 is stress management. You cannot deal with stress by yourself. Talk to a friend, talk to a colleague, talk to a spouse, talk to a counselor, but you can't deal with stress by yourself. It's bad for you. The next thing is that's a pillar in lifestyle modification for health is restorative sleep. And that will be between 7 and 9 hours of sleep per night. And I'm laughing because I find it really hard to do that too, like everyone does, because life gets in the way. But I'm just telling you the pillars. They say 7 to 9 hours per night. This is very important. And also is very good research has found that the secret to lifelong happiness is also tied to socializing. You cannot spend your time in your room, on your computer, on a screen, and not making social connections. It will decrease your happiness. You have to get out and enjoy life with other human beings. You can't stay on a computer all the time. This is one of the pillars they found. And the last one they found was avoid risky substances, which makes sense too. I always like to finish talks with these quotes because I really think it is the core of what I believe in. And Sun Tzu is a famous Chinese military strategist from 500 BC, so almost 3,000 years ago. He wrote this book called The Art of War, and it's so valuable with its lessons that even military strategists today use this book. One of his famous quotes that he said was, "The battle is won before setting foot on the battlefield." And think about it. If you wait to get on the battlefield before you start practicing and knowing what to do, you've already lost. Another way of saying the same thing is Ben Franklin said, if you fail to prepare, you are preparing to fail. And I think this is a very, very important concept that we have to embrace for the rest of our lives. Are you trying to get a promotion? Do you want more money? Are you trying to be a better parent or teacher or person at your job? Are you trying to start an exercise routine or trying to lose weight or any goal that you're trying to do? Are you failing to prepare? Because if you are, then you're already going to fail. On the other hand, if you're investing in yourself and taking time to be healthy and an active participant and studying like you should, or doing the things you should at work, or investing in your parenting and learning different styles, or investing in your relationships or your kids or whatever, then you're not failing to prepare. And then consequently, you will succeed. You will find success. So ask yourself, and whatever your goals are you failing to prepare? I hope not. And with that, we'll open it up to questions. Cece, wake up.
I'm awake. I'm awake. Sorry. I was trying to get some sleep.
Oh, okay, that's fine.
Is there so one of the questions that came in and I saw was, which I thought was interesting, it was a good, so, okay, you have pain. It's going to take a while to get rid of it. You have these 6 pillars. So do you think that the question is, can you do one of those 6 things that will still help your pain? Maybe start eating a little bit better or moving a little bit better, or, just trying to get more sleep, even though you're still in pain, just try to continue to do those things? Or do you think you got to get rid of the pain first and then you can kind of do those things? It's kind of a catch-22, right?
I understand your question, but I think, no, you can do it stepwise. I think you can actively start doing those 6 things right away. Everyone can sleep 30 more minutes right now. Everyone can decide to have medium fries instead of large fries. Everyone can decide to have 1 more salad a week, or have 1 less soda a week, or walk 10 steps farther than they could today, tomorrow. Okay. So I think that don't go first in 75, go first in 10, or go first in 1. Just make 1 step toward achieving your goal, because every step is an achievement. Every step towards your goal is a step towards your goal, as long as you take 1 step. Don't stay stagnant.
What about, is there a certain exercise when people are trying to get through their health that you would recommend to everyone? Maybe there might be modifications, even though you're having pain, or maybe you're recovering or something, or should they just be still, or should they just rest? Is there a certain exercise or something, or a kind of exercise that you would recommend?
Right. Good question. And what I'll say is listen to your body and understand the severity of your injury. Obviously, if you have a broken arm, it's going to be hard to use your arm. Okay. But if you have a strained shoulder or a strained muscle, then it's much easier to be actively involved with your healthcare. When I get hurt, I try to follow my own suggestions and try to rest it, try to keep it elevated, try to keep it moving, even if it's on the ground and I'm moving joints like my ankles or knees, because it increases blood flow, which decreases inflammation and helps with healing. And do a resistance band. So I do a lot of resistance band, especially with soft tissue injuries, to slowly get rid of the inflammation and strengthen the soft tissue as well. Fundamentally, though, I think a big part of treating pain or preventing it is core strength. So a lot of times I'll do core strengthening, whether it be yoga or Pilates or swimming or whatever, because if you have a strong core, that gets you more of everything, right? The core strength is very important to any type of health that you have to have.
What are some of the most common ways that people hurt their back? I know you said that standing and sitting and all that, but is there some best practices? Should you stand at your desk? Is that better? Is it the shape of your chair? Is it your posture? Some basic things like that's pretty surprising that sitting and standing are what causes back pain.
Yeah.
You think it's I'm lifting a box wrong, or I got in a car accident or something like that. What are some basic things you can do while sitting at your desk or when you're standing?
Some basic things you can do while you're at work is the body doesn't like to be in one position for a long time. And like 30 minutes. Your body, if you sit down a while, you're going to start fidgeting because there's decreased blood flow, there's increased pressure on one joint or certain segments. So the body likes movement. So my job is actually perfect because every 10 to 15 minutes, I'm standing up, walking around, sitting down, talking to patients for 5 or 10 minutes, getting up, walking around, sitting down, and I'm always up and down and up and down. And that's really good for me. Okay. Unfortunately, a lot of people don't have that situation. They have to sit at a desk. So what I would do if I was in that situation is every 30 minutes or 45 minutes, stand up and get a mobile desktop that will raise or lower. And also very importantly is change your head position. Because a lot of times patients are like, or people are like this, always on the computer, and it causes neck dystonias or neck problems because muscles aren't meant to be used for 8 hours a day without rest. So what I would recommend is you turn your body sideways and you type like this for a little bit, and then you turn it sideways and you type like this for a little bit, to always change the position of your neck to prevent cervical dystonias or neck problems from looking at a screen for 8 hours a day or 10 hours a day.
Are you seeing more injuries to the neck and to the shoulders or to the fingers or to the hands because of cell phones?
Oh yeah, definitely. I don't see though, but the research clearly shows that cell phones and being on screens is bad for neck and shoulders and hands. Yeah. And there's actually stories about teenagers that have frozen fingers because they're texting so much. They can't straighten their fingers anymore, so they have to go get treated.
Wow, that's
Yeah,
incredible.
the social media thing is definitely not social.
Yeah.
It's much better to, like I said, socialize. You have to get out and talk to humans and talk to people and interact and get off the screens.
So in your practice, and I know this is hard to tell, but when just I mean, I can see if you're overweight and all that, but why does smoking really affect your overall health? I mean, I know it's bad for your lungs and everything like that, but is it healing? Is it what about tobacco?
Yeah.
What about chewing tobacco?
Well, smoking or tobacco products are bad for your health. Everyone knows that. Specifically for pain, it's because they cause constriction of blood vessels, and consequently, you have less blood flowing to organs. So that will change metabolic profiles or capabilities, as well as healing nutrients that go to injured areas. So say you hurt your knee and you're smoking, you have less nutrients going to the knee to help it heal. Okay. Also, it can change the breakdown of medicines. So it can increase the metabolic breakdown of pain medicines. So what I tell patients is smoking makes your pain worse because it sends less nutrients and healing, and it makes your pain medicines work less. So it's a double-edged sword. If you're smoking, you're making your pain worse and you're making your pain medicines work less just from smoking. So if you're trying to cure or treat chronic pain or any pain while you're smoking, it's like trying to swim a sprint wearing a 50-pound pack. You're just never going to win that win. Nice. You got to stop smoking if you want to optimize your pain management, without a doubt.
What about this whole, like all these, vitamins and things that people are using? Do you really think that those things help, like with preventing or helping you recover from an injury or anything like that?
I think that there's good literature and research that shows it can if you're treating the right thing. So you have to treat the right problem. So say you have a vitamin D deficiency. If you're taking vitamin E, that's not going to help with that.
Right.
On the other hand, if you're taking vitamin D, you treat the thing that you need, then it would help with that. So you got to understand what the problem is. In the end, is you got to identify the correct problem. Patients come to me and they say, I tried that and that and that. And then I examine them and I say, well, your problem isn't any of those. It's something else. And that's why you're not getting the benefit, because you're not treating the problem. You're taking something, but it's not the right treatment. So with herbal medicines or vitamins or whatever, as long as you have a deficiency of those, or they're helping you out because you need those for your life, then I think there's a benefit. But if you have ample vitamin D, there's no need to take vitamin D, is an example.
What about sodas, caffeine?
Sodas, I don't really advocate sodas drinking too much. Certainly I have sodas every once in a while. I prefer water because I try to stay hydrated because once again, those are diuretics. So they increase your urine output. They constrict things, increase your blood pressure and your heart rate. And there's all kinds of artificial sweeteners in sodas that are bad for your overall health as well. Everything, once in a while is fine. It all comes with moderation. So, if you're drinking 16 a day, that's not going to be good. If you drink 16 a year or a month, that's probably not going to do anything to you as long as you're investing in your health in other ways.
So what was it that made you want to go into pain management? And isn't there like you said there's a shortage of doctors. Is there a shortage of pain management doctors?
Yes, there's about 330 million Americans right now, and there's about 5,500 pain doctors in the country. It's just a relatively new field. There's not a lot of people doing it. So consequently, pain doctors are busy. There's not enough. And that's probably true for a lot of specialties. I don't know the other specialties, but there's a shortage of doctors, and it's projected to only get worse moving forward. We can't generate doctors fast enough to treat the growing population. That's what. So doctors are being forced into a position where there's more need and not enough healthcare providers to help them. So consequently, if you have more need coming and you have so much time in a day, you have to see patients on a faster and faster basis to see more patients. Unfortunately, that's the way medicine is right now. Even if they're trying to build more medical schools and increase the rates, they can't build them fast enough. The population is growing too fast.
So is that why you're motivated to do this, to really encourage people to,
well,
I mean, really, when you think about it, you're really kind of talking yourself out of business. So, you're trying to get rid of
if I cure all pain, then I won't have a job. That'll be fine with me.
Yeah.
Okay. My purpose is to try and teach people that they can't really rely on other people to help them out as much as we used to. They have to take themselves into their own control and be an active participant because there's not enough providers to go around. So when you think about solving a problem, so during COVID, they made a bunch more nurses because there wasn't a nurses around. So they made it so nurses could get credentialed faster. Okay. What they did was they empowered the masses to help treat a problem. In my opinion, the way we're going to treat chronic pain or health or medical expenses is to empower the masses, which means education. If you can educate people about what's going on and they hurt their back and they say, oh, I know what that is because Dr. Moran showed me a video, or I learned on one of his videos that that's a bulging disc. I know that I need to not do this and I need to do this and I'll try this medicines and I follow my insurance guideline. You're empowering the masses to treat themselves before they come to see the doctors. Then when they come to the doctors, it facilitates treatment because they've already done a bunch of stuff. So imagine the Civil War. The North and South were running out of military people. So what did they do? They recruited people to help fight, and it helped them out. So I'm trying to encourage people to become active participants and empower the people with the knowledge of what they need to treat this pain. Obviously, if it's not getting better, that's when you come see the doctor and we'll help out. But knowledge is power, and I'm trying to give that knowledge to people so they know what to do before coming to see me.
How many of your patients do you see that you've actually see that they've done everything and they're doing things right? And do they work? And I know it varies because of their situations, but you see that people who really take this to heart, okay, I'm going to start eating better. I'm going to start walking a little bit more. I'm going to drink more water. Do you see that what you're doing for their pain management is going faster than?
Absolutely, without a doubt.
So it's not just covering up. You're not just dealing with the symptoms. You're really getting to the core of the problem.
And a lot of people now are on weight loss medicines, and they're losing lots of weight, which is great because they're healthier and there's less stress on their joints and their spine. So their pain is getting better just from losing weight. That's what I'm saying is, if you become an active participant, just losing weight will minimize your pain. I have to give a shout out to my favorite patient. You know who you are, but I know you've lost a lot of weight, and consequently, their pain is much better.
Good to hear. Are there any other questions? I mean, I've gotten a lot in here. We've talked about a lot. You've made me have a lot more questions, and I've been working with you and I still have questions, but is there anything else that you want to say?
I just want to see the blooper reel when this is done. And I want to thank everyone for coming on and taking your time to listen to me. I know everyone's very busy. You guys have lives, and I'm a big advocate. I tell all the students and people and groups I talk to that my job is a part of my life. My life is not a part of my job. So I understand that you guys have lives that you need to take control over and enjoy. So thank you very much for dedicating 1 hour of your time to listen to me. I hope you learned something. And now that you know where you are, it's time to take control and decide where you want to go and take steps to getting to that direction.
Don't forget to tell them how they can reach out to you. Because you really mean it. You really want people
I
to do it.
actually,
Next couple slides.
oh, there's another slide.
Yeah.
Oh, look, I didn't even know. There you go. Stay connected with Dr. Mark. Follow him on Facebook, Instagram, and LinkedIn. You can always email me at drmarkmoranhelp@gmail.com. I'm happy to answer those questions. Check out my website. It's markmoranmd.com. There's lots of good information on there about back pain and options. You can go to my other website called 1 Month MD and learn about how to empower yourself over back pain and learn about the causes and treatments and prevention of back pain that will benefit you for the rest of your life.
So your goal is to just continue to give information and content for people and
Just
work
make-
with other people and share ideas and
Just
learn.
make myself available to answer questions because I know a lot of times patients don't get to ask me all the questions they want. And I apologize for that. I'm trying to make myself available and bring in community people to help promote their jobs as well.
One last thing, on YouTube, you do have exercise videos that to strengthen your core, to help you stretch appropriately to prevent. That's another opportunity for people if they need just a quick, small demonstration on what you need to do. That those are there on YouTube as well.
Correct. I do have YouTube videos about how to strengthen your core because it's so important. And you can make fun of me all you want. That is fine. As long as you're getting better, I'll happily take jokes about me. Anything else? I don't know how to turn that off. Is it going to be on all the time? Oh, thank you very much for your time. I wish you the best of luck as you become an active participant in your health and your happiness, and you will find success. We'll see you next time.